Hi everyone, my name is Amanda Beal and some of you know me as the facilitator of one of our class sections, but since you don't all know me, I'm just going to take a moment and give you a little background information on my experience before I jump into this lecture. So earlier in my career, I worked in public health for several years. I served as a Healthy Maine Partnership Director in Southern Maine, where I oversaw programs focused on policy and environmental change at the community and state level. I worked on issues such as increasing physical activity, reducing obesity, increasing access to healthy food and nutrition education, and reducing tobacco, drug, and alcohol use. I hold a master's degree from Tufts Friedman School of Nutrition Science and Policy, where I focused on food production impacts on human and environmental health, with insights that were really greatly informed by my work in public health. I'm now working on my PhD at the University of New Hampshire, and I'm continuing the study of food systems, impacts, and sustainability. So this week, I'm really thrilled to have the opportunity to talk with you about my area of interest and expertise, which is related to food systems. And in this lecture, I'll reflect back on some concepts related to system science that we've covered in earlier lectures, and I'll explain how they relate to this topic, which also links back to obesity and a number of other public health issues, as you likely already know. I'll also talk about a project that I've been involved in New England that I think will illustrate a real-world example of how these concepts are being applied to solve food system challenges in the present, and hopefully laying the foundation for elements of a healthier and more sustainable food system for the future. So I hope you enjoy this lecture and the next several slides that are to follow. So this slide and the next two should look very familiar to you. I've borrowed them from the lecture that Dr. Boulos posted in Module 1, so you've seen this text before, but I've included this first slide just to remind us of broadly what system science is, which is essentially a way of looking at complex issues that may have many influencing factors with the purpose of identifying efficient strategies for reaching desired outcomes. This is another image from Module 1, which should look familiar as well, and it depicts a systems map that basically illustrates the complexity of factors that influence obesity. I also want to remind you of something from one of the readings from Module 1. If you recall that Lisho and Milstein in Systems Thinking and Modeling for Public Health noted that a systems approach is a paradigm or perspective that considers connections among different components, plans for the implications of their interaction, and requires transdisciplinary thinking as well as active engagement of those who have a stake in the outcome to govern the course of change. And then they go on to make what they refer to as 4 critical points that are important to keep in mind as we implement a systems approach in our public health work, which essentially are that, first, relationships and a good understanding of human nature are at the heart of an effective systems orientation. Second, there's a need for specialized information in order to inform good decision making. But third, you must also be able to transcend academic boundaries, which can be difficult at times, and I would say other types of boundaries as well, given the transdisciplinary nature of complex issues like obesity. And fourth, it's important to have the ability to understand and potentially incorporate mixed methodologies in our work, as complex issues may require some integration of various disciplines to solve. And from my experience, I want to offer up a 5th consideration, which is really because time and funding are almost always a limiting factor in our world and in our work, I think that issues of great complexity, such as depicted here, really require strategic thinking about where key leverage points exist so that we can really focus resources and most effectively affect the system to produce the desired change that we're looking for. And this, of course, is easier said than done oftentimes, but I do think it's a point that really must be considered in the work that we do in public health. And for one last point of review, here's the socio-ecological model that, as Dr. Boulos has noted previously, is used to inform multi-level interventions in public health. And it can also be a great tool for helping to think about those key leverage points I mentioned just a moment ago. So as we move through the next few slides, I want you to be thinking about these frameworks and how they can be applied perhaps to help us better understand impacts on human health influenced by the current structure of our food system, and what you think some key leverage points or effective targets for intervention might be from a public health perspective. So now let's look more closely at the food system. Like the previous map that shows the complexity of issues related to obesity, this system map also reveals that there are many components that make up our global food system, which definitely has an impact on human and environmental health in many ways. So as you can see, it is indeed very complex. And if you look within this diagram, you'll also see elements that relate to the layers of the socio-ecological model. Consumer choice relates to the individual level, research institutions operating at the community level, and government and regulation at the policy level. As I mentioned in the last slide, our predominant global food system is complex, and as you can see, many of the challenges related to this model are also complex and often interrelated. To address these challenges, it really requires the ability to see these relationships and to find the best intervention points that will effectively create desired change. One of the ways of addressing a number of the challenges listed here that we see increasing interest in is in shortening the chain between the food producer and consumer. For example, building a more localized food system can reduce the time needed to transport fresh foods, which means the consumer can benefit from higher nutrient levels. Another benefit that can be realized by building local capacity for food production is greater food security. And in addition, having access to information about the person or business producing our food allows us to determine whether their practices are environmentally sustainable and also whether they treat their workers well and pay them a fair wage. And when food is coming from far away, we don't always have the opportunity to know these things. Over the last decade, New England has really been a leader in the work to build local food system infrastructure. And one result of this can be seen in the 2012 USDA agricultural census data, which confirms that the number of farms in all 6 New England states is actually rising as much of the country continues to see a decline. And most of this increase is due to an increase in small to medium-sized farms, which are the most engaged in the direct-to-consumer marketing activities, such as operating farm stands and offering community-supported agriculture shares, as well as innovative processes to aggregate, process, and distribute food on a more local and regional level. Recently, I had the opportunity to work with a group of researchers to investigate what it might look like if we strategically work towards producing a much greater amount of our food in New England over a span of the next 50 years. And the report we released in June of this year is shown here. It's called A New England Food Vision, and in it we considered many elements of the food system and looked at the region's existing natural resource base, projected population, dietary needs, environmental and social impacts of localizing food production, and a number of other things. And what we found is that New England could quite successfully produce at least 50% of food needed for the region, and perhaps even as much as 70%, offering and assuring that everybody has access to a varied and healthful diet. And this is a big leap forward from the maybe 5 to 10% of food that's produced and remains in this region currently. But in order to get to 50%, there are many changes that need to take place in the context of our food system. One way that we propose approaching changes to our food system is to really place core values at the center of our decision making. This diagram comes from our report where we explain that a food system includes how food is produced, consumed, and disposed of in all its material and social dimensions. Food is produced on the land and in the ocean, processed into forms in which it is distributed to consumers at markets, stores, and restaurants, prepared and eaten. Waste at any stage can become a pollutant or can be recycled. Health in one part of the system can be linked to health in all other parts. In a New England Food Vision, a holistic food system is guided by 4 core values. Everyone has access to adequate food. Everyone enjoys a healthy diet. Food is sustainably produced, and food helps build thriving communities. Now, because the New England Food Vision is just that, an aspirational vision, the real work to determine how we get to providing 50% of the region's food needs is really happening at the state level. And currently, each state in New England is undergoing its own strategic food systems planning process. If you're interested in knowing more about how each state is approaching this work, I would invite you to go to this website for Food Solutions New England, which I've provided the address for here. But in the next slide, I want to highlight one state that is really out in front of the rest and helping to lead the way toward developing very effective strategies for systemic change and using really good process to do that. Vermont's Farm to Plate program was actually underway a few years before the New England Food Vision was even published. And this project got its start because policymakers at the state level decided that they would create legislation and dedicate funding toward a comprehensive statewide planning process to strengthen their local food system. And at the heart of this decision was an interest in realizing the economic development potential of supporting food-related businesses, but there were other goals as well. And since that time, Vermont's Farm to Plate program has engaged many stakeholders throughout the state in a very successful participatory process, and they've now established some concrete goals tied to indicators to help them measure success over time. So a few examples of these include a goal to increase consumption of Vermont-produced food by Vermonters, and the indicator that they're using to track that is to track the estimates of local food expenditures in Vermont overall. Another goal that they have is to increase locally produced food in institutional settings, so schools, colleges, even state agency cafeterias, hospitals, prisons. And so again, they're going to, as an indicator of progress, they're going to be tracking institutional purchases. And I will say I had an opportunity recently to tour one of their hospitals, Fletcher Allen Healthcare in Burlington, and they've just done a phenomenal job there of really bringing in a lot of locally sourced food. About 30% of their budget is spent on locally grown and organic food. And they're really creating a model of a food program within a hospital that is really healthful and gets at their goals of trying to heal people and model good healthy eating. So they're well on their way with that goal in Vermont. Another goal that they have is around Vermonters exhibiting fewer food-related health problems like obesity and diabetes, and the way that they're looking at tracking that is by tracking the number of overweight and obese adult Vermonters. So, this is just one way that systems thinking is being utilized to make change related to public health and obesity, among other issues. So I hope you've enjoyed this presentation and that you'll spend a little time looking at some of the resources I've provided here. And if you want more information, you're welcome to contact me. I would be happy to provide lots more information for anybody who's interested. So thank you.